is here, and with the heat come a new array of health issues. I'm joined in studio by our resident doctor, Dr. Darren Green, and he's going to tell you what you should be on the lookout for. Hello.
Good afternoon.
It is very hot outside.
It is indeed.
And I don't see it getting any colder any sooner. So tell me, with this heat, what should we be looking out for when it comes to our health?
I think obvious things are protection from the sun. So everyone knows about ultraviolet A and B rays, the effect that those can have on your skin, specifically things like skin cancers, and your lips need protection with a decent SPF. And we always recommend starting with a SPF of 30. It's not as important, how high the SPF is, the sun protection factor. What is important is how often you apply it, and especially considering the season for water sports, you can imagine it gets washed off and you need to reapply it. So along with that, all the other skin conditions associated with summer, the people that suffer from heat rash, in children we find very specifically small red papules all over the body that happen in response to sweating and really, really hot weather. And then of course the sufferers of eczema and allergies at this time of the year are put under a tremendous amount of itchiness, as you can imagine. The discomfort due to the sweating, the heat, but also the increased amount of pollen from all the flowers and plants at the moment is quite dramatic, as well as the spraying of the vineyards in our part of the country anyway. And then of course dehydration. So everyone wants to be outdoors and do sport and play outside when it comes to children. So you can imagine your fluid requirements are increased. You need to drink a lot more water and fluids, along with protecting yourself from the sun. And then because of all the festivities, we tend to want to play a lot without washing our hands. And playing outdoors also means some contact with some bugs and so forth, from sand pits, so worm infestations, etc. But in the water specifically, things like UTIs, people that stay in the water for a long time, stay in their wet clothes after swimming for a long period of time. That's urinary tract infections amongst a lot of our female, specifically patients. And then of course we must remember diarrhea as this part of the year. So a lot of the organisms become quite active, the viruses, in the summer months with a drastic change in temperatures. And on food, when we defrost food and we're preparing food, if it's not defrosted properly, because of that prolonged period at room temperature, you can imagine enterotoxins form as part of certain bacteria, like salmonella, etc., that can cause significant dysentery and GIT side effects.
Now, I want to speak about all of those in just a moment, but I want to touch on allergies first.
Sure.
I have a lot of friends who are suffering from allergies right now. What can these people do to relieve themselves?
I think the first thing to note is, do you know what you're allergic to? So you need to control the environment as best you can. Some people have food allergies and they don't even know what they're allergic to. So they continue introducing the trigger of their skin eczema and allergies, for example. They continue having dairy and cheese and nuts and spring rolls, not knowing that they've got this low degree of inflammation that's chronic in the body. So I think knowing what you're allergic to is a good place to start. And there's simple tests that can be done on your blood for that, as well as the assays where we look at your skin prick tests, an example as well. And then of course the environmental factors, things like horse, cat and dog dander, those dry scales of skin that get shed in the household, on your bed, on your pillow, on your couch, on the carpets, for example. And then Bermuda grass, for example, weeds, house dust mite, which is a big one. And often the little kiddies come in with blocked noses at this time of the year and allergies when there's a down pillow put in their cot. So a lot of them are sensitive to down feathers, for example. So one has to control the environment as best you possibly can with a type of flooring, type of environment, pillows, duvets, etc. But then also look for chemical irritants such as your washers, in other words, your shampoos, your soaps, your stay softs and all that kind of thing. You need to look at your fabric softeners, your washing powders, if you have skin irritations and manifestations of allergies.
Now, when we're talking about diarrhea and UTIs, I would imagine with diarrhea, washing your hands will help prevent that, and UTIs not staying in a wet swimming costume for a long time. Is there anything else we can do to prevent these?
Sure. Using public toilets, you can imagine, is a big risk. So always learn how to sanitize the toilet seat. Have a bit of wet wipes with you when you go to the loo, for example. We teach girls particularly in which direction to wipe after using the bathroom. And it's very important to exercise those from a very small age, that people are aware of that. And then, of course, the other thing with UTI specifically, the distance from the outside skin to travel to the bladder in females, obviously the distance of the urethra is very short. So it's much easier for them to contract urinary tract infections. So treat it early if you do have one. Don't wait until it becomes so painful and there's blood in the urine and severe pain over the flanks and kidneys where it spreads up the two ureters towards the kidney. That can cause dire medical consequences.